Hello and welcome to the Preoperative Education for Bariatric Surgery here at Reston Hospital. This is an overview of what to expect, not just prior to your surgery and day, but also important information for during your stay and as you prepare to go home. My name is Roz Barron. I'm the Bariatric Coordinator and one of the nurse leaders for Reston Hospital. My function is to work in close liaison with you, your surgeon, nurse, and of course your family. You can expect a daily visit from either me or another nurse leader. Our goal is to deliver excellent care. You're in safe hands. Reston Hospital is accredited by our regulatory body, the MBSAQIP. We have a well-trained and understanding staff throughout the hospital. We work together as a team. Rooms are private, there's a gift shop, parking in the garage, or if you wish, valet is available, and which is free on your day of surgery. In preparation for your surgery, 3 to 4 weeks, see your doctor for any tests and make sure clearances are done. Please stop smoking and alcohol intake. For females, please use appropriate birth control as directed by your OB/GYN. Please schedule a preoperative interview at least 2 weeks prior to surgery at Reston Hospital by calling the number below. Typically, it's done over the phone. During this preoperative appointment, the pre-surgical nurse will go over your medical and surgical history. In order to help make it easier for you, please make sure you have a current list handy, including any over-the-counter medications, and also have orders from your surgeon, list of doctors, and contact numbers, and your pharmacy. At this time, you'll be told if you need any lab tests or anything else. You will also be told how to prepare for the surgery, such as do not use lotions, take the necessary pills, once again, per doctor's orders. What to bring to Reston Hospital? Please bring your ID and insurance card. Any adaptive equipment such as eyeglasses or hearing aid, regular toiletries, loose-fitting clothes, favorite pillow if you like, list of current medications, and if you use a CPAP, please bring both the mask and the hose. Also know your settings. The policy here is that we don't use your CPAP machine. So on the day of surgery, please come in, register at Pavilion 2. The registration area is located on the first floor. You have the address right next to me. It's open Monday through Friday. Please arrive 2 hours ahead of time. You will be greeted by a pre-op nurse. You will meet with the anesthesiologist and the surgeon. Now, an intravenous catheter will be inserted into your vein and blood might be drawn at this time. The preoperative staff will take you to the operating room. Each surgery takes a different amount of time. It could be between 1 to 3 hours, depending on the type of surgery. Your surgeon will be the best to answer this question. And of course, if there's a hiatal hernia or anything like that, it might take a little bit longer. In the recovery room, you will be closely monitored. One of the questions there will be, how much is your pain? We'll be asking you on a scale of 0 to 10. 0 being no pain at all, 10 being the worst possible pain. We would like to keep you at around the 5 mark, if at all possible. You will remain in the recovery room for 2 to 4 hours, and once awake, you'll be cleared by the anesthesiologist and be transferred to the surgical unit on the 4th floor. What to expect on the surgical 4th floor? You will most likely be groggy and in some pain due to the gas. We want to help make you as comfortable as possible. You will be getting out of bed within approximately 2 hours of getting to the floor. This will help with that gas pain that you will get after surgery. The best way, once again, to dissipate this is by getting up and taking smaller walks and then continuing on with that. Your goal is to walk at least 4 walks per day and to increase this as tolerated. Your pain will be managed with scheduled and/or needed medication. Please be sure to communicate to your nurse if your pain level is not at a tolerable level. You will have a call bell and a phone to do this. You will also have vital signs taken every hour for the first 3 hours upon arrival to this floor. After that, it'll be every 4 hours. Diet varies due to the type of procedure and surgeon, but expect either to have ice chips or clear liquids right after surgery. When you do start fluids, you'll be limited to 1-ounce cups, and we will be counting them. Some surgeons prefer to order a test called an upper GI study, which requires you to have nothing by mouth until the test is done and the results are available. Your nurse will let you know if this test is ordered. After that, then you will start with the bariatric clear liquid diet. For the liquid diet, you will receive a standard tray with the following items. You will either get sugar-free or diluted liquids such as Crystal Light packets with water, diluted apple juice, broth. No straws are allowed, no carbonated beverages, But one of the most important pieces of information to take away from this whole video is that you must sip slowly. Drink only from the 1 ounce cups provided to ensure the correct amount of liquid is consumed so that we can measure it. And please do not drink large amounts of any liquids, including water. Just let the water trickle down. Be careful, especially when taking medications, not to take too much. Put the medication at the back of your throat and just take a small sip of water to help it down. Do not take a second sip right away. So with this cup, what you want to do is take about 8 times to get through this cup. You're just going to be slowly sipping it, letting it trickle down your throat. Please don't have any hiccuping, burping, pressure, or pain within the first 4 seconds. So what happens is you're drinking 1, 2, 3. That's a little bit too much. Next time you want to stop. The next time you take in liquids, you want to take even a smaller amount. So blood work might be done as early as 4:30 in the morning. This is so the results are in by the time the doctor comes to see you. We do need to perform basic tasks for your well-being and safety after your surgery, such as taking vital signs and drawing bloods. Unfortunately, these may not always come at a convenient time for you. We might interrupt your sleep. I do apologize ahead of time. Sorry, we try to do our best to group tasks together to minimize these interruptions. Just so that you know, nurses are dressed in navy blue scrubs, techs are dressed in green. Your nurses are the only ones allowed to give you medication or make adjustments to your IV pump. Techs are able to help with walking, food items, hygiene, various things like that, including vital signs. Now, anyone can do those things. We can all pitch in and help out, but the techs really are the ones who are going to be mostly doing that. So this is an incentive spirometer. You'll be using this hose to breathe in. You'll be watching the side here. We want it to go as low as possible, so not up in this area. That'll be the best breath. Also on this side, this is measuring how much you're taking in. It's kind of like a game. We're going to start off at a lower level and then start increasing it as you can get better. You'll be using this about 10 times an hour while in the hospital, and then you'll be taking this home and practicing it there as well. Also, cough with a pillow. You want to put the pillow wherever there's pain and cough after you use your incentive spirometer. You will have sequential and compression devices, or SCDs, on your legs. These will help prevent blood clots. When you start to walk by yourself, we'll want to hook them back up. So if you need us to help you hook them back up, please let us know. We're there once again to assist you. We have what's called Musicure. This is a wonderful way to distract you from pain. This is obviously in addition to your pain medications. The nurse and the tech will visit you regularly to make sure all your needs are being met. If we are not, please call us. We're just a push of a button or a phone call away. You will be allowed to shower either the day after surgery or the next day. Please be very careful of the IV, not to tug or dislodge it. Also, you will need to be mindful of your new incisions. If you have Dermabond on, do not pull or scrub that area and just pat it dry when you're done. Don't put any lotions on or around the incisions either. We just want to keep them as clean as possible. You can expect to stay a couple of days. We want to make sure that you are taking in enough fluids. We do not want you to get dehydrated. Typically, drinking about 4 of those 1 ounce cups is a good amount to let you go home. Please don't rush through this process. We start you off just drinking 1 ounce, and then if you don't have any signs of overfilling, once again, such as pressure, pain, hiccuping, burping, within 4 seconds of drinking, then we will advance you slowly. When you take a pill, please wait at least 5 minutes before taking the next one. You will be taking them one at a time, once again, approximately 5 minutes apart. For discharge, I'll be bringing discharge instructions for what you need to know when you go home. And of course, diet information. That's a big one. We want you to stick with what we're giving you. Please, this is for your own benefit. Here are some things to think about for when you leave the hospital. Incision care. Please don't soak them. Don't put any lotions around them. Don't rub them. They will heal. If you see more redness, swelling, if you feel heat or smell an odor, right away, please call your doctor. For activity, you'll want to get up every couple of hours and walk at home. You'll be able to do the stairs, but be kind to yourself and listen to yourself. Don't perform any strenuous activities in the following week after surgery. Also, please don't lift anything over 25 pounds. If you have pain, redness, swelling, tightness in the calf of one leg, once again, please call your doctor. If you have any increased or severe pain, nausea, or any vomiting, also call your doctor. For pain, patients can have Tylenol at home. The biggest issue with pain is typically right away when you get up from surgery, and that's the gas. And walking is going to help dissipate that. You will be given dietary instructions from your surgeon. It's very important to follow them. We've gone over what to do before surgery, day of, and we've looked ahead at some information that will help you when you go home. Please make sure you fill out the form below with your name and date of surgery. Thank you so much for watching. Good luck with your surgery, and I look forward to seeing you soon.